This morning, President Trump sparking concern in the medical community, asking about the possibility of injecting coronavirus patients with disinfectant.
And then I see the disinfectant where it knocks it out in a minute, 1 minute. And is there a way we can do something like that by injection inside or almost a cleaning?
The president's question last night was immediately challenged by doctors.
While this virus is certainly sensitive to many different disinfectants like isopropyl alcohol and bleach, there's no protocols where we would consider injecting any of those substances into us, and the risks would almost certainly outweigh the benefits.
Trump also suggested the idea of treating patients with UV light.
So supposing we hit the body with a tremendous, whether it's ultraviolet or just very powerful light. And then I said, supposing you brought the light inside the body, which you can do either through the skin or in some other way.
Those comments quickly drawing skepticism from medical professionals.
If the president thinks that tanning beds are going to cure the coronavirus, he's mistaken.
The president is growing more confident that summer heat will weaken the coronavirus.
The findings confirm that the virus survives better in colder and drier environments.
According to Homeland Security Department scientists, the virus struggles in warm and humid weather, on non-porous surfaces, and in the air.
But now you inject the sun, the half-life goes from 6 hours to 2 minutes. That's how much of an impact UV rays has on the virus.
But scientists also point to the coronavirus spreading in warmer climates, like in Singapore, where the number of cases recently doubled. Back in the U.S., Vice President Mike Pence is making this optimistic prediction as 23 states show a decline in cases.
If we continue these mitigation efforts in the days ahead, as states implement their policies, including phased reopening that will preserve those gains, we do believe by early summer we could be in a much better place as a nation with much of this coronavirus epidemic behind us.
Many experts say the only way life can return to normal is with a coronavirus vaccine. At Oxford University, the first human trials are now underway. Researchers believe they'll be able to determine the vaccine's effectiveness possibly by September.
Well, personally, I have a high degree of confidence about this vaccine because it's technology that I've used before.
And now word the virus may have spread more widely in New York than first thought. A preliminary study tested thousands of people at grocery stores for coronavirus antibodies. The finding, 1 in 7 people in the state may have already had the virus. In New York City, it's even higher, 1 in 5.
I think it confirms the point that it spread faster and it got here earlier than we originally believed.
Do you think that those travel bans, in retrospect, made a difference?
Well, in retrospect, close the door on China. Yeah, that makes sense. But it had already left China. Close the door on China, the virus is already out. You know, it's closing the barn door when the horse is gone.
Regarding the antibody study in New York, it's important to note that only people outside grocery stores were tested, not a random sample of the population.
Hi everyone, George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel, and don't forget to download the ABC News app for breaking news alerts. Thanks for watching.